Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Nigeria records lowest daily figures of coronavirus cases since about 5 months. National Laboratory in Abuja selected as one of the 12 labs in Africa to serve as genomic sequencing center for COVID-19. And World Health Organization reports record daily rise in COVID-19 infections, over 307,000 new cases confirmed in just 24 hours. Now, for the first time in almost 5 months, Nigeria recorded the lowest daily infections of COVID-19 at 79 cases. The new infections were recorded in 12 states and the Federal Capital Territory, with Lagos recording 30, Kaduna 17, Ogun 7, Anambra 5, Kano 4, Katsina 3, the FCT 3 as well. Same with Akwa Ibom. 2 were recorded in Rivers and 1 each in Delta, Plateau and Ondo states. Before Sunday's record, the last time the country recorded less than 100 new positive samples was on April the 27th, when 64 cases were confirmed. At that time, Nigeria had 1,337 cases, out of which 251 patients had recovered, and sadly we'd lost 40 persons. But since April, the daily cases of COVID-19 had increased, and by August 27th, Nigeria had crossed the 50,000 mark confirmed cases. Even though the numbers are changing, the message remains the same, and that is to reduce your likelihood of becoming infected with COVID-19. Follow the non-pharmaceutical protocols. Try not to touch your face, especially avoid touching your eyes, your mouth and nose. If the virus is on your hands, touching your face can make it easier for the virus to infect you. The Nigeria Center for Disease Control also reports that 4 deaths was recorded in Nigeria last night. Till date, the total cases in the country stands at 56,256, with over 44,000 discharged and 1,082 deaths recorded in the 36 states and the FCT. According to Dr. Chikwe Hekwazu, the Director General of the NCDC, its National Reference Laboratory, Abuja, has been selected as one of the 12 laboratories on the continent to provide genomic sequencing capacity for COVID-19 on the continent. He says that the partnership with the Africa Center for Disease Control and Prevention and the World Health Organization Regional Director is important in determining the response to various SARS-CoV-2 strains and in helping countries manage localized or imported transmission. In Africa, where the total cases of coronavirus cases is at 1,353,283, over 1 million people have recovered, and the death toll stands at 32,625. Now, the Yobe State Governor, May Mala Buni, has commenced distribution of food palliatives donated by the federal government to vulnerable persons across 17 local government areas of the state. Making the presentation in Buniyadi, the headquarters of Gujba local government area, an area worst hit by the Boko Haram insurgency, the Executive Secretary of the state's Emergency Management Agency urged the beneficiaries not to sell the items.
Buniyadi is the worst-hit local government area in Yobe State, having been under the control of Boko Haram insurgents between 2014 and 2016. Life has now returned to normal, but the residents, who are dominantly farmers, still have challenges getting back to their farms due to the activities of the insurgents. The federal and state governments are now distributing food palliatives to mitigate the effect of both the insurgency and the COVID-19 pandemic on the communities.
Trying to build the resilience of people, one thing you will do is to ensure that you support them so that they will feel encouraged and stay in the community. Government has built roads, government has reconstructed hospitals, government has reconstructed police station, government has reconstructed the secretariat, community houses are being reconstructed, schools and market is being reconstructed. So in terms of livelihood, we also want to encourage people so that they will build their resilience. Buniyadi is most affected local government during the Boko Haram crisis. That's why for every intervention, the number in Buniyadi increases. And most importantly, some of the donors, they target their interventions specifically to Bunyadi, specifically to a particular location. So when we are bringing the intervention, we give cognizance to all these criteria when we select our beneficiaries.
The beneficiaries applaud the federal and state governments for considering their plight during the trying moments.
We are appreciating the federal government of Nigeria and even the Governor Maimala Buni for his concerning the people of Bunyadi for the relief materials that he have given to the people. So we really appreciate his concern on the people.
This is my first time to receive palliative of any kind. I have been given sugar, rice, salt, among others. I'm grateful to the government.
The federal government had earlier donated 69 trucks of food palliatives to be distributed across the 178 political wards of the state.
Delta State government has commenced the batch delivery of palliatives to vulnerable households in the state, an intervention of the private sector coalition against COVID-19, CACOVID. Addressing newsmen at the exercise in Asaba, the Commissioner for Information disclosed that 179 households have been targeted in its 270 wards across 25 local government areas. He stresses that modalities have been put in place to ensure that the items get to the targeted beneficiaries.
All these things that we're doing, we have DSS, we have the Nigerian Army, police, all being involved, and they have the reports of each of the local government. For us, the report that come to us so far is that, yes, there are some local government that, some wards, political class hijack. We are learning from that experience and trying to get it now. We're going to have reports, and we're going to be going around to make sure that these things are done properly. If they are not done properly, you have the feeling and you get the information.
Everybody deserves to be assisted at a time when the economy is quite rough. But CACOVID, indeed, just like our government, realized that it is not going to be possible to feed everybody at the same time. And so to make this process transparent and fair to those who you regard as very vulnerable, 199 households were taken note of in each of the federal wards, and the names have been compiled. So once these different food items get to the different local governments, the food will now go to these federal wards. 179 households will be taken care of in each of those federal wards.
Let's now bring in an update from Imo State. Here's our correspondent, Tokwe Kutei.
The use of face masks and keeping social distancing are some of the major precautionary measures put in place by the NCDC and medical authorities to contain the spread of COVID-19. And ahead of the October 31st by-election in Imo North Senatorial District.
The Imo North Senatorial District is made up of 6 local governments. And I presume you know the local governments. Ehimembano, Ihitu Boma, Isialambano, Obowo, Onuimo, and Okigwe.
According to Inec, these protocols are pertinent, considering the fact that polling units are always crowded during elections. The Resident Electoral Commissioner of Inec in Imo State, while meeting with newsmen in Owerri, Imo State capital, took our time to reel out the protocols put in place by the Commission for electorates and stakeholders to adhere to during the elections.
There are new rules to guide the election as a way of protecting our people against COVID-19 infection. Some of these guidelines have been published, and in due course we'll be releasing the details to you. We expect individuals who are coming to vote to come with their face mask. We are going to maintain social distance at the poll. And of course, because of the protocols and procedure, the election will no longer start by 8 a.m., but will start by 8:30 a.m. and then end by 2:30 p.m.
Hopefully, electorates, political parties and stakeholders will cooperate with the NCDC and INEC to contain the spread of COVID-19 during the election. From Owerri, Imo State capital, Tokwe Kutei for COVID-19 updates.
Now let's talk about discussions between the joint health sector unions who said their members should go on strike. This is over the federal government's inability to meet their demands. Joining us from our Abuja studios is Comrade Ogbonna Obinna. He's the National Vice Chairman, Joint Health Sector Unions. Jeheso, also the President, National Union of Allied Health Professionals. Thank you for joining us on the program. I'd like to ask, is Jeheso officially on strike, or is this a warning strike?
Yeah, thank you very much. Thank you for having me. Yeah, the present strike is a warning strike, a 7-day warning strike. And it has been declared because of the inability of the government to be able to concretize and discuss passionately with the joint health sector unions in resolving some of the perennial issues that had lingered for years. So the members were so distressed and surprised that even now that we are giving in our best, being the foot soldiers that are trying to curtail or defeat COVID-19, there are no morale booster. Issues that had lingered over the years, issues about infrastructures and the infrastructural decay in various hospitals that we have cried over for so many years. Thank God that the COVID-19 came around, and it's no more a secret that various health facilities are not in order. And well, all effort that had been made in the past to call the attention of the government to some of this decay did not get to their ears. But now that those in authority do not have the means of traveling out as well, we are now trying to call the attention again to focus on issues of infrastructure, then issue of welfare that will create, that will boost the morale of our members to giving their best. So these are some of the things that we want the government to beam their searchlight on, and to discuss pragmatically with us to reaching resolutions.
Are all members taking part in this warning strike? Are all members away from their duty post? Because the federal government has said that any strike by Jeheso will be deemed to be illegal, saying that it has put in conciliation, which has begun, and according to international and local conventions, while that is on, Jeheso shouldn't go on strike.
Well, thank you very much. The reason why the strike had to proceed is because, naturally or legally, there is a provision for those of us who are in essential duties that we should give a minimum of 15 days notice to the government. And the government is also advised within that 15 days to meet the needs of the people, to resolve the matter. But we were hurriedly called for a meeting on Thursday, 10th of September, just about 2 days to the expiration of the ultimatum. And during the course of discussion, the government side made some proposal. And according to the organogram of the union platform, when such discussions are going on, whatever be the outcome of the discussion, such outcome should be taken back to the expanded Inec, and it will be discussed, and the Inec will direct us on the way forward. All of this, we only took 5 items to the government. The issue of the infrastructural and structural decay in the health sector, the issue of correction of the COVID-19 allowances paid to our members. Instead of paying them 50%, some of them were paid 10%. The issue of withheld April and May salaries and other withheld salaries of our members in FMC Owerri, Jute and Lut. The issue of our adjusted conheads, the adjusted conhead salary. has done for
finally, Comrade Obinna, you're saying that
members in
you're
2014.
saying that you haven't violated any rule with this warning strike and that it is legal. That's what you're saying.
Yeah, our strike is legal because we followed the procedure in declaring it.
We do hope that there is an agreement at the end of the day. We want to appreciate your time, Comrade Ogbonna Obinna, the National Vice Chairman, Jehesu. Thank you for joining us on the program.
Thank you.
We have more on the global response to COVID-19 when we return. Please stay with us.
The following measures are crucial in the fight against COVID-19. Maintain 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Do not touch your nose, mouth or eyes. Remember, avoid physical contact with people. Simply greet with a wave, a nod or a bow.
Welcome back. Sporting activities in Ogun State, southwest Nigeria, remain closed due to the coronavirus pandemic. The closure of sports centres, suspension of activities were part of measures taken by the state government to halt community spread of the pandemic and to flatten the curve. A visit to some sports centres in the state capital reveals that both the indoor and outdoor games, lawn tennis, volleyball, basketball, among others, show no signs of sportsmen and women. Speaking on the development, the President, All Stars Football Association, appealed to the state government to reopen the centres, especially the non-contact sports.
All the stadia was shut down, and there was no any sporting activities anywhere. In football, particularly, there was no any training. All the leagues were cancelled. Then it has affected the economy too, because those that are selling, these people that are selling at the stadium, they could not come. And also it's affected the club owners, because they are not playing league. Because and if they are not playing league, spectators will not come. There will be no profit for them. And that has forced them to slash the players' salary. And it affected the players too, because the money is not enough for them to take care of their family.
Well, away from Ogun, it is said that most people who become ill with COVID-19 will be able to recover at home. No specific treatments for the virus exist right now, but some of the same things you do feel better if you have the flu, getting enough rest, staying well hydrated, taking medications to relieve fever, and others also help with COVID-19. Therapies that are under investigation, however, include drugs that have been used to treat malaria, autoimmune diseases, antiviral drugs that were developed for other viruses, and antibodies from people who have recovered from COVID-19. We have a clinical pharmacist in the studio, Mr. Gbenga Martins, to tell us more about what it is we're using in Nigeria. Thank you for joining us.
Thank you very much for having me, Millicent.
But first, I'd like to begin with the common diagnosis for COVID-19 patient in Nigeria. What is that?
Yeah, it still hasn't changed. Thank you very much. It still hasn't changed. These things still remain. Things like coughing, fever, like you rightly pointed out, shortness of breath, and then headaches, especially people that have either been linked or have been in contact with someone that had the viruses. Those symptoms are still the same. And unfortunately, it's because they appear same things you would feel with a lot of illnesses that are seen. Yeah, common illnesses. So that's why, by maybe diagnosis. But however, those things haven't changed. If there is now when the patient has gone, if a patient has had some reason to be around a patient that has been confirmed with COVID-19, he can then go forth and then have a test done to confirm that.
So what are the medications that are used? I know in the past we've talked about the dextromethasone, there's been talk about hydroxychloroquine, azithromycin, a lot of that. And some countries are using, some others are not.
Yes.
Some are still under clinical trial state.
Yeah, thank you. And that's understandable because the WHO has been criticized for being reactionary. But they've tried to put forth a guidance statement to ensure that whatever is done is safe and effective. Whatever treatment protocol is taken is safe and effective. You spoke about hydroxychloroquine and antiviral agents used. What they have comfort, the WHO has a position right now, released earlier this month, and they basically say that they recommend corticosteroids, but the systemic administration of corticosteroids for patients with severe or critical cases of COVID-19. They also maintain that those corticosteroids should not be used in patients that have, a less severe or moderate case. Now, while all of these things are still ongoing, there are still trials even being done here. I'm aware of some trials being done here in Lagos. The Lagos State chloroquine treatment trial, because chloroquine, like I said, is on the essential medicine list. It is readily available, and they want to have our own data to show that these medications work in our own population so that we can create, and because Nigeria is, the world's most populous black nation. So if we can give data, at least that shows that, some of these widely available medications provide some effect or provide some efficacy in our local population, then we can have a stance and have a position on that.
In the meantime, it's still a race for a vaccine.
Oh, yeah. And that one hasn't stopped as well. That one hasn't stopped as well because the Oxford trial that was stopped about earlier this month is scheduled to go on because they had a patient come down with an ADR. And that's because vaccines, whatever vaccine, has to be safe and effective. But safety is paramount because you're going to put it in across a large number of people. So these vaccines have to be safe. And that's why, the trial, the trial can continue now.
All right. We'd like to thank you, Mr. Gbenga Martins, clinical pharmacist. Thank you for joining us on the program.
Thank you very much for having me, Millicent.
On Sunday, the World Health Organization reported a record daily increase in cases, with 307,930 reported over a 24-hour period. The same day, U.S. President Donald Trump held his first indoor rally in nearly 3 months, despite warnings that the gathering could violate COVID-19 restrictions. This comes as coronavirus deaths in the country approaches through 200,000. Here's more on our COVID-19 global update.
India reported 94,372 new cases of coronavirus on Sunday, taking its total cases past 4.7 million, as infection numbers rose in several states amid a gradual opening up of businesses. India's figure joins the US and Brazil's to add up to the 307,930 new confirmed infections by the WHO, reaching a new daily record globally. US recorded 45,523 and Brazil confirmed 43,718. Despite public health official warnings against large indoor gatherings, US President Donald Trump held a Nevada campaign rally at an indoor venue on Sunday. People in the crowd were seated close together and many did not wear face masks. The president's last major indoor rally caused the controversy after a number of staffers tested positive for coronavirus. The U.S. has so far confirmed almost 200,000 COVID-19 related deaths since the pandemic began. Here in Africa, Kenya is set to begin trials of a COVID-19 vaccine developed by a British company in partnership with Oxford University. The trials will target hundreds of health workers who are on the front line in the battle against coronavirus. These are the people that will be among the first participants in Kenya to take part in clinical trials for a COVID-19 vaccine being developed by AstraZeneca in partnership with Oxford University. And Australia's second most populous state, the epicenter of the country's coronavirus second wave, reports its lowest single-day rise in new infections in nearly 3 months. Officials recorded 35 new cases and 7 deaths in Victoria as a tight lockdown in the state capital of Melbourne is partially eased.
That's it on the program. Don't forget, you can take a closer look at some of the COVID-19 global numbers in real time. Visit our website. It's channelstv.com. You get more updates and a better understanding of how to stay safe. And reports coming in from Benin City indicates that the Inspector General of Police, Mohammad Adamu, is meeting with the Inec leadership, political party leaders and candidates for the forthcoming elections in Edo and Ondo states. They're discussing the modalities for the elections in observance of the COVID-19 protocols. We'll bring you more updates on that story. That's the program this afternoon. Thank you for watching. I'm Millicent Mwaka. Stay healthy.